I'm about to tell you something that could save your life. Something I see in the operating room that your primary care doctor will never catch. Heart failure doesn't start with chest pain. It doesn't announce itself with a dramatic collapse. It starts quietly, in ways most people dismiss as getting older. I'm Dr. Claire Whitmore, cardiac surgeon, and what I'm about to reveal isn't taught in medical school. Most primary care physicians miss these early signs because they're looking for the obvious: swollen ankles, shortness of breath, the textbook presentations. But heart failure is sneaky. It hides, it mimics other conditions, and by the time the obvious signs appear, the damage is often irreversible. There are 5 signs I see over and over in patients that tell me this heart is failing. They're subtle patterns only someone with surgical experience recognizes, patterns that can prompt an echocardiogram before it's too late. Let's begin with sign number 5. You've stopped sleeping in your bed. Over 6 months, you've slowly added pillows. First 1, then 2, then 3, and now lying flat feels impossible. You move to a recliner and tell yourself it's just more comfortable. Your back feels better there, but it's not your back, it's your heart. This is orthopnea, one of the most specific signs of left-sided heart failure. Here's why it happens. During the day, gravity pulls fluid into your legs, and your weak heart manages. But the moment you lie flat, gravity stops helping. Fluid redistributes to your chest, increasing blood volume by 20 to 30% within minutes. Your failing left ventricle can't pump that extra volume forward. Pressure backs up, pulmonary pressure rises, and fluid leaks into your lungs. You feel restless, uncomfortable, and instinctively prop yourself up. This is pulmonary edema, internal drowning, happening slowly enough that most people think it's just aging. Take Robert, 74. He hadn't slept in a bed for 8 months, assuming it was a bad back. His echocardiogram revealed an ejection fraction of 30%. Every night, lying flat filled his lungs with fluid within 10 minutes. Orthopnea develops gradually. 1 pillow, then another. Each small change feels minor, but the pattern tells the real story. A failing heart. If you can't lie flat, if you need multiple pillows, or if you've moved to a recliner, this is not preference, it's compensation. Now, let's talk about sign number 4, the shoelace sign, also called bendopnea. You can walk fine, climb stairs, no shortness of breath during normal activity, but the moment you bend forward to tie your shoes, within 30 seconds, you're gasping for air. You sit up, catch your breath, and try again. Doctors often dismiss this as out of shape or thinking you held your breath, but it's not. It's your heart struggling with elevated filling pressures. Here's what happens. When you bend, your diaphragm pushes up, increasing chest pressure. Your abdomen compresses, sending blood back to the heart. A healthy heart handles this, but a stiff or failing heart cannot. Pressure backs up instantly, fluid enters the lungs, and shortness of breath sets in. Margaret, 69, experienced this. Her ejection fraction was normal, but her ventricles were stiff. Any preload increase caused immediate backup into her lungs. This is heart failure with preserved ejection fraction. Next is sign number 3, the bathroom run sign, called nocturia. You wake up 3 times a night to urinate, assuming it's your prostate. Medications don't help. The cause? Your weak heart. During the day, fluid pools in your legs because your heart can't circulate it effectively. At night, lying down redistributes this fluid. Your kidneys sense the increased blood flow and produce urine, lots of it. James, 71, had leg swelling during the day and was up 5 times nightly. His heart was failing on both sides. If you urinate more at night than during the day and have swollen legs, this is cardiac nocturia, not a bladder problem. Sign number 2 is the appetite paradox, known medically as cardiac cachexia. You feel full after 2 bites, eat less than half of what you used to, but somehow the scale keeps going up. You're gaining weight without eating calories. Where is it coming from? Fluid, not fat. Right-sided heart failure causes blood to back up into your liver and intestines, swelling them. Early satiety kicks in, nausea sets in, and food absorption drops. At the same time, your body activates the renin-angiotensin-aldosterone system, holding onto sodium and water to compensate for low cardiac output. The result? Rapid weight gain from fluid. You're starving and drowning simultaneously. David, 73, gained 12 pounds over 3 months despite losing interest in food. His abdomen was distended, legs massively swollen, and his right ventricle was leaking blood backward through the tricuspid valve. Cardiac cachexia is a late, severe sign of heart failure. Sign number 1 is the after-lunch fog called postprandial hypoperfusion. You eat lunch and within 30 minutes you feel dizzy, lightheaded, foggy, confused. Your blood sugar is normal, but your heart is failing to supply both your gut and your brain at the same time. Blood flows to digestion, the brain is deprived, and hypoxia sets in. Eleanor, 80, seemed demented after meals, but between meals she was fine. Echo revealed an ejection fraction of 28%. Heart failure, not Alzheimer's, was the cause. These 5 signs, the recliner chair sign, orthopnea, the shoelace sign, bendopnea, the bathroom run sign, nocturia, the appetite paradox, cardiac cachexia, and the after-lunch fog, postprandial hypoperfusion, are what primary care doctors often miss. Recognizing these early allows testing with BNP, B-type natriuretic peptide. BNP rises when the heart is under pressure, signaling heart failure even before other symptoms appear. Normal BNP under 100 pg/ml usually rules out heart failure. The test is simple, cheap, and life-saving. If BNP is elevated, request an echocardiogram. This will measure ejection fraction, evaluate valves, assess diastolic function, and check chamber size. Early detection allows treatment with diuretics to remove fluid, ACE inhibitors or ARBs to reduce resistance, beta blockers to improve heart function, and sometimes aldosterone antagonists for advanced disease. Heart failure caught early is manageable. Caught late, it has a 5-year mortality worse than many cancers. I want to share something I'm building. Senior Health Life Daily. A community for seniors to get detailed medical insights beyond these videos. I'm finishing an e-book about cardiovascular health specifically for seniors. How to read lab results. Ask the right questions. Identify emergencies versus watch and wait situations, medication side effects, and practical diet and lifestyle changes that actually work. It's free for members. No ads, no sales, just life-saving information. If you experience any of these signs, advocate for yourself. Request a BNP test, get an echocardiogram, and don't accept it's just aging. Early detection saves lives. Share this video with anyone over 60. These 5 subtle signs, orthopnea, bendopnea, nocturia, cardiac cachexia, postprandial hypoperfusion, could save someone's life. Comment if any resonate. Your experience might help others recognize the warning signs. Subscribe to stay informed. Take care of your heart. It's the only one you've got.